Let's study multiple myeloma. Multiple myeloma is the malignant neoplasm which is derived from the plasma cells. This is the most common primary bone tumor in the adult, accounting for 50% of all bone tumors. On pathology, it characteristically affects the flat bones like the pelvis, vertebra, skull, and the ribs. It may have solitary lesion, which is the plasmacytoma, and it may have the multiple lesions called the multiple myeloma. The lesions of the multiple myeloma are mostly small and circumscribed. The bone is simply replaced by the tumor tissue. There is no reactive new bone formation like in Ewing sarcoma and the osteosarcoma. Grossly, we see that the tumor is soft, grey, friable, and lies within the medulla. The cortex is thin and broken, but no new reactive bone is formed. Microscopically, it consists of sheets of closely packed round cells having an eccentric nucleus with with clumped chromatin arranged in the spokes of wheel pattern. We can see the spokes of wheel pattern and eccentric nucleus. Multiple myeloma commonly occurs in the age group of 50 to 70 years. It most commonly occurs in the male with the ratio of 2:1. It characteristically affects the flat bones, but any bone with hematopoietic red bone marrow can be affected, like the pelvis, vertebra, skull, ribs, sternum, and the proximal femur. When the multiple myeloma affects the spine, lumbar spine, thoracic spine, it causes severe bone pain, which is precipitated by the movements, which differentiates it from metastatic pain. Metastatic pain is usually worst at the night during rest, but multiple myeloma pain is precipitated by the movements. When there is persistent pain, it signifies the pathological fracture, especially of the vertebra and the ribs. If the tumor presses on the spinal cord or the nerves in the spinal canal, neurological symptoms can be seen. Local bone tenderness is seen. As it is the tumor of the plasma cells, and plasma cells form the B cells and B cells forms the antibodies. So due to decrease in antibody, due to hypogammaglobulinemia, there is increased susceptibility to the infection, due to which pneumonia, pyelonephritis, renal failure, hypercalcemia, hyperglycemia, osteoporosis develops and complicates the prognosis of the disease. On complications, it can cause the pathological fractures of the rib, spinal cord or nerve root compression. Pancytopenia can occur, anemia, leukopenia, thrombocytopenia, severe infection due to hypogammaglobulinemia, amyloidosis, renal failure, and Fanconi syndrome. Hypercalcemia and hyperglycemia can occur. On investigation, we do the radiology. In radiology, we can see the multiple punched out lesions in the skull, pelvis, and the other flat bones. Here we can see multiple punched out lesion in the skull in the multiple myeloma. Biconcave vertebral bodies and pathological wedge collapse of the vertebra. It is central collapse of the vertebra, usually more than one, which is commonly seen in the thoracic spine. Osteolytic lesion penetrates the cortex, but there is no periosteal reaction. It penetrates the cortex, but periosteal reaction like in osteosarcoma, Ewing sarcoma is not seen in the multiple myeloma. Diffuse severe rarefaction of the bone. Rarefaction may be extensive, disappearing vertebra, and there is vertebral pedicle involvement. If there is involvement of the pedicle of the vertebra, it is called the pedicle sign, and erosion of the borders of the ribs. After radiology, we can perform the other investigations like in the blood, as there is pancytopenia, so low hemoglobin can be observed, high ESR which is more than 100, increase in total protein, albumin globulin ratio is reversed, high serum calcium, urea, nitrogen, creatinine and the uric acid, everything is high, serum calcium, urea, nitrogen, creatinine, uric acid, ALP is normal alkaline phosphatase. In urine, we can see the Baines-Jones proteins in 30% of the cases. But this Baines-Jones protein can also be seen in the leukemia and the Hodgkin lymphoma. On serum electrophoresis, we see the abnormal spike M band in the region of gamma globulin myeloma spike. In 90% of the cases, we can see the M band abnormal spike. Bone biopsy can be taken from iliac crest, CT guided needle biopsy from the vertebral lesion, bone scan in which there is increased activity, open biopsy can be done. For the treatment, we control the tumor by the chemotherapy and splintage of the diseased part by the plaster of Paris and the brace. Chemotherapy is used like melphalan, melphalan, which is given in combination with vincristine, cyclophosphamide, prednisolone in repeated cycles and are repeated every 3 to 4 weeks for 6 to 12 cycles. If there is neurological compression, localized painful lesions and soft tissue masses, then radiotherapy plays a great role. Surgery is done, laminectomy in spinal nerve compression and intramedullary fixation for the pathological fracture of the long bones. For the prognosis, we see the serum beta 2 microglobulin, which is the single most powerful predictor of the survival. This multiple myeloma disease is widespread and very fatal. Death occurs within 3 years in majority and within 5 years in almost all cases. So, multiple myeloma, this is the malignant neoplasm which is derived from the plasma cells. This is the tumor which is derived from the plasma cells and this is the most common primary bone tumor in the adult. Pathology, it characteristically affects the flat bones like pelvis, vertebra, skull and ribs. It may have solitary lesion, plasmacytoma or the multiple lesion. Lesions are mostly small and circumscribed. The bone is replaced by the tumor tissue. There is no reactive new bone formation. Grossly, it is soft, grey, friable and lies within the medulla. Cortex is thin and broken. Microscopically, it is arranged in the spokes of wheel pattern, having an eccentric nucleus with a clumped chromatin and consists of sheets of closely packed round cells. On clinical features, it occurs in the age group of 50 to 70 years, mostly occurs in the male, mostly affects the flat bones like pelvis, vertebra, skull, ribs, sternum. When it involves the lumbar and the thoracic spine, there is bone pain which is increased in movement, while the other metastatic pains are watched at night. If there is persistent pain, it signifies there is pathological fracture, especially of vertebra and the ribs. There is neurological symptoms if the tumor compresses the spinal cord or the nerves in the spinal canal. Local bone tenderness can be seen as it is a tumor of the plasma cells. There is decrease in the beta cells and antibodies formation. So there is increased susceptibility to the infection due to hypogammaglobulinemia and cause pneumonia, pyelonephritis, renal failure, hypercalcemia, hyperglycemia, osteoporosis and complicates the prognosis. On complications, it can cause the pathological fracture, it can compress the spinal cord or nerve root, pancytopenia can occur, severe infection, amyloidosis, renal failure and Fanconi syndrome, hypercalcemia and hyperglycemia. On investigation, we do the radiological in which we can see the multiple punched out lesion in the skull. Here we can see. Multiple punched out lesion in the skull. So we can do the radiology, we can check the blood in which there is low hemoglobin or ESR is very high, more than 100. Albumin globulin ratio is reverses. High serum calcium, urea, nitrogen, creatinine, uric acid, normal ALP. In urine, Benson's protein is increased. On serum electrophoresis, we can see the abnormal spike M band in the region of gamma globulin. Bone biopsy can be done, bone scan can be done, open biopsy. So radiology, urine, serum electrophoresis, bone biopsy, bone scan, and the bone biopsy. For the treatment, we can control the tumor by chemotherapy, radiotherapy, and we can do the surgery. For prognosis, serum beta 2 microglobulin is the single most powerful predictor of the survival. Disease is widespread and very fatal. Death occurs within 3 years, majority, and 5 years in almost all cases. So this is the multiple punched out lesions in the skull in the multiple myeloma. We can see the multiple punched out lesions in the multiple myeloma. This is all about the multiple myeloma. You can find these notes on the Telegram and the links are given in the description. Thank you.